Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by microbiologist. Today in this video I am going to explain another lecture that is related to the tumor marker, and it is about the CEA blood test. If you guys remember, we already talked the AFP blood test that is related to the tumor marker. Now this is the second video, that is the tumor marker related video. And if you miss AFP blood test, you can go back to my channel and watch about the AFP blood test. So today I'm going to explain CEA blood test. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. Now first of all, let's see that what are the main content that we are going to explain in this video. In this video we will see that what is CEA, then we will explain diagnostic purpose, test procedure, normal range, main causes of high CEA. Let's see the introduction. CEA is actually tumor marker test. The full form of the CEA is Carcinoembryonic antigen. Okay. Now what is CEA? It is actually the glycoprotein, or we can say it is the antigen that is normally produced from the gastrointestinal cells of the developing fetus. Okay. This protein or antigen will be decreased at the age of 1 year. Okay. So remember, when the CEA level get high in the blood, so it indicates the malignancy, and all of you better know that malignancy is the tumor, and all of you better know that malignancy is the cancer. Then we have the diagnostic purpose. So for what purpose we perform that test? So this test is specially performed to check the high level of CEA. So CEA level will be decreased, not high. Okay. Next we have the CEA test is also recommended to assess the malignancy chances in the body. This test is also used to monitor the colorectal cancer. Colorectal cancer means the cancer of the colon, especially of the large intestine, that contain ascending colon, transverse colon, descending colon, and rectum, and then anus. Okay, so if there is a cancer at that area, we call it colorectal cancer. So due to this test we can diagnose colorectal cancer. Due to this test we can also diagnose the treatment efficacy, the treatment which is provided to normalize the level of the CEA. So if it is working, the treatment, so for that purpose we also perform this test. Let's see the normal range. So the normal range of the CEA will be less than 3 nanogram per ml, especially in that person who are non-smoking. And if a person is smoking, so their normal range of the CEA will be less than 5 nanogram per ml. Now let's see the procedure. So the procedure of the CEA, here I write AFP, but this is the CEA. So the procedure is very simple. You need to take the blood in gel tube, then you will centrifuge it to get serum, then you will run it on advanced semi-automated machine or fully automated machine, and you can also process the test using ELISA technique. Now what are the main cause of high CEA? This is, again I write here AFP, but this is actually CEA. So the main cause of high CEA is acute pancreatitis and renal failure. Renal failure means kidney failure. Okay. In case of breast, colorectal, lungs, ovarian and pancreatic cancer. In case of bacterial pneumonia. In case of cholecystitis, diverticulitis. In case of liver cirrhosis, smoking. In case of peptic ulcer disease, chronic obstructive pulmonary disease and pulmonary emphysema. Radiation therapy, Crohn's disease like irritated bowel syndrome, hypothyroidism, leukemia and neuroblastoma. So these are the main causes through which the CEA level get increase in the blood. So this is all about the CEA. I hope you guys get idea about that. So thank you so much for watching this video. If you like this video, make sure to hit the like button, share this video, and subscribe the channel to get more interesting videos like that. Thank you.